Menstrual problems in women of all ages. Menstruation, often referred to as periods, is a natural and essential part of a woman's reproductive health. It is a monthly process that signifies a woman's reproductive potential. However, menstrual problems can affect women of all ages and may lead to physical discomfort, emotional distress, and even health complications. In this comprehensive overview, we will explore various menstrual problems that women encounter throughout their lives, including irregular periods, heavy bleeding, painful periods, and menopause-related issues. We will discuss their causes, symptoms, diagnosis, and treatment options, highlighting the importance of seeking medical advice when needed. Irregular periods. Irregular periods, also known as menstrual irregularities, are a common concern for women of all ages. They refer to variations in the menstrual cycle, including cycle length and the amount of menstrual bleeding. Irregular periods can be caused by various factors. Hormonal imbalance, hormonal fluctuations, particularly imbalances in estrogen and progesterone, can lead to irregular periods. This may occur during puberty, perimenopause, or as a result of certain medical conditions like polycystic ovary syndrome, PCOS. Stress. High levels of stress can disrupt the regularity of menstrual cycles by affecting the hypothalamus-pituitary-adrenal axis, which controls hormone production. Weight fluctuations. Extreme changes in body weight, whether through rapid weight loss or gain, can influence menstrual regularity. Conditions like anorexia nervosa or obesity can contribute to irregular periods. Medications and health conditions. Certain medications, such as contraceptives or anticoagulants, and underlying health issues like thyroid disorders can impact the menstrual cycle. Symptoms of irregular periods may include unpredictable bleeding, skipped periods, or unusually heavy or light flow. Diagnosis involves a thorough medical history, physical examination, and sometimes hormone level testing. Treatment options depend on the underlying cause and may include lifestyle changes, hormone therapy, or surgery in severe cases. 2. Heavy menstrual bleeding, menorrhagia. Heavy menstrual bleeding, or menorrhagia, is characterized by excessive blood loss during menstruation. This condition can affect women of all ages and may result in anemia, fatigue, and reduced quality of life. Common causes of menorrhagia include uterine fibroids. Non-cancerous growths in the uterus can lead to heavy bleeding and painful periods. Adenomyosis. This condition involves the tissue that normally lines the uterus growing into the uterine wall, causing heavy bleeding and severe cramping. Hormonal imbalances. An imbalance in estrogen and progesterone levels can disrupt the normal menstrual pattern, leading to heavy bleeding. Blood disorders. Some bleeding disorders, such as von Willebrand disease, can cause heavy menstrual bleeding. Treatment options for menorrhagia may include medications to control bleeding, hormonal therapy, minimally invasive procedures like endometrial ablation, or surgery, hysterectomy, in severe cases. 3. Painful periods, dysmenorrhea. Dysmenorrhea, commonly known as painful periods, is a menstrual problem that can affect women of all ages, but it is most prevalent in adolescents and women in their 20s. There are 2 types of dysmenorrhea. Primary dysmenorrhea. This is common menstrual cramping that occurs without any underlying medical condition. It is usually caused by the release of prostaglandins, which cause uterine contractions and pain. Secondary dysmenorrhea. This type of pain is associated with an underlying medical condition, such as endometriosis or uterine fibroids. Symptoms of dysmenorrhea may include pelvic pain, lower backache, nausea, and diarrhea. Management strategies vary and may involve over-the-counter pain relievers, lifestyle changes, hormonal treatments, or surgery for secondary dysmenorrhea. 4. Menopause and perimenopause. Menopause is a natural biological process that marks the end of a woman's reproductive years. It typically occurs around the age of 50, but perimenopause, the transitional period leading up to menopause, can start in a woman's 40s. Menopause-related issues include Hot flashes, sudden, intense feelings of heat and sweating, often accompanied by a rapid heartbeat, are common symptoms of menopause. Vaginal dryness and atrophy. Reduced estrogen levels can lead to vaginal dryness, itching, and discomfort during intercourse. Mood changes. Hormonal fluctuations during perimenopause and menopause can contribute to mood swings, anxiety, and depression. Osteoporosis. The decline in estrogen levels increases the risk of bone loss and osteoporosis in postmenopausal women. Hormone replacement therapy, HRT, is one treatment option to alleviate menopausal symptoms, but it comes with potential risks and benefits that should be discussed with a healthcare provider. Lifestyle changes, including diet and exercise, can also help manage symptoms and promote overall well-being during menopause. Menstrual problems can affect women of all ages, from adolescence through menopause. These issues can have a significant impact on a woman's physical and emotional well-being. Understanding the causes, symptoms, diagnosis, and treatment options for irregular periods, heavy bleeding, painful periods, and menopause-related concerns is essential for maintaining reproductive health and overall quality of life. It is important for women experiencing menstrual problems to seek medical advice and guidance to address their specific needs and concerns. By doing so, they can improve their overall health and well-being throughout their lives.